Hello, I am Dr. Amy Sanders, and I am here at Sunday Health, where I am the Dementia Neurologist, and I am sitting with Amber, who has graciously agreed to speak with me and all of you today about her experiences as a care partner for somebody who is living with dementia. And in your case, the person living with dementia is your mother, right? Can you just tell me her story? Tell me about your mother, and then, if you can, how she got diagnosed.
My mother is 79 years old, and the diagnosis is actually a good question because even though it's been 4 or 5 years, there was an initial diagnosis from a senior care worker that I took her to when I first started seeing signs that there was something definitely off.
What was the first thing you remember noticing?
It was a very specific thing, honestly. And I don't know, in hindsight, I now recognize several different things that were clearly early signs of dementia.
The retrospectoscope,
Yes.
we call that, and
Yes.
it is often so accurate.
Yes, and I feel guilty now because there were times when I was frustrated with her because, simple tasks I would write down for her to do, just working the DVR and VHS tape thing. And I was very specific with steps for her to do, and she would just never do it. And I just thought she just couldn't be bothered by it. I thought she just didn't want to bother with it. But now I know that I don't think she was capable of following those, even the simplest instructions.
And didn't want to admit that.
And didn't want to admit that.
Probably, yeah.
But there was one specific instance where she had referred to having a safety deposit box at the bank. And we discussed getting that paperwork out of the safety deposit box, finding out what these papers were. And we said, let's go tomorrow, let's go at this particular time. Next day rolled around, I said, so you ready to go to the bank for, to the safety deposit box? And she said, what safety deposit box? I had no memory whatsoever of that whole conversation we had the day before. So that was the smoking gun.
Yeah, that was your
Yes.
uh-oh moment.
Yes, right. And at least I knew then, I guess I had the wherewithal to know, okay, I needed to move quickly. I needed to become her power of attorney. I needed to get on her accounts, and I needed to find out if it was indeed dementia or what type of dementia. My grandmother, her mother, died of Alzheimer's. So I was familiar with my grandmother having had Alzheimer's, so I knew that this was clearly something that was potentially hereditary. And I believe I just did a Google search, I think, just to find out where I should take her. And it was called senior care. It was a senior care doctor, I believe. Maybe she wasn't a doctor, but they did a preliminary test, which I now know, I guess, is a standard test where they have you draw the hands on the clock and they have you do those certain things. And I just remember that the number in which you have Alzheimer's is 18, and she was at 16.
Probably what you're referring to is some sort of cognitive screening test. And a cognitive screening test will tell us there's a problem. It doesn't tell us what the problem is or how bad the problem is. It just indicates that there might be a problem. So whenever there is a screening test and somebody screens positive, meaning they sort of failed the test, they rule in for whatever the test was screening for, then we want to do what's called confirmatory testing. And in dementia, that can mean much more in-depth cognitive testing, usually testing that examines a person's ability to pay attention, to use their memory, to use language, to reason abstractly and make judgments and determinations, planning, and also to interpret visual and spatial information. And it can get a little bit more complicated than that. Those are the 5 main areas that we look at. And then usually at least one test, sometimes more than one test, in each of those thinking types is given to a patient, gets scored, and the whole sort of picture gets looked at as a whole. And we determine whether there is an impairment in one or more types of thinking. So if there's an impairment in memory, which is never normal, no matter how old a person is, then that's a memory impairment. And memory impairment is required for a diagnosis of Alzheimer's disease. But Alzheimer's disease is not diagnosed only on the basis of the presence of a memory impairment. A lot of people think that dementia is a disease It's not. It's what we call a syndrome or a collection of symptoms. Let me put you on the spot for a second. If you heard that your next door neighbor had cancer, what would be your next question?
What kind of cancer?
Exactly right. If you heard that your neighbor on the other side had dementia, do you have a follow-up question?
Now I do.
And what is that?
What type of
What
dementia?
type of dementia? Right, and that's the meat and potatoes. That's where we always find the crux of the matter, because there are many diseases, some people say as many as 100 diseases or conditions that can produce the dementia syndrome. All dementia means is that there's cognitive impairment, and that cognitive impairment is significant enough that it is making it hard for a person to live their lives and take care of themselves in the way that they normally do. So for your mother, forgetting a conversation about a really important topic within 24 hours was not normal. So you were absolutely right. You did all of the right things. What happened after that?
Well, unfortunately, due to family issues, I wasn't able to monitor and be the one who took care of her for at least like the next 2 years or so. Flash forward to the money's running out. Do you want her to live with you, or do you want her to live with me? And it was, I want her to live with me. So that's how that came about. And that was when I had to kind of like, I guess, pick up where I had tried to start, at the beginning, and just hit roadblocks. It was
What
really,
kind of roadblocks?
well, it's just really interesting that it seems as though I've heard the term and knew there was such a thing as a dementia specialist. It seemed like that would be a thing, but I just couldn't seem to find
Couldn't find
any.
one, right?
I couldn't find one. And you need to talk to this person.
We are unicorns. There aren't very many of us.
Okay, well, it would have been fantastic if I would have met you earlier. But I assumed, of course, that a primary care doctor or the general practitioner would have recommendations or referrals to point her in various directions with whatever ailments his patients might have. But yeah, it was absolutely a dead end. I was told to speak to this person and then to call this facility, which in turn tells me to go, contact this person. And so ultimately, just from doing Google searches.
Do you feel a little bit like a hot potato that was getting passed from one place to another?
Yes, and it just seemed like such something that should be easy to find and to navigate, because this is something that's
so important.
Yes, and there's a lot of people that have dementia, so why wasn't this easier to find? And so from my searches and from my various conversations with people, I just assumed that neurologist was who I needed to talk to, and found one. And of course it was important to find someone hopefully through her insurance, and so that's what I did. Found the doctor that had dementia, somewhere in their little summary. Then, of course, there's the issue of, yes, we can make an appointment, but it'll be, 6 months from now.
A lot of times what happens is in the primary care world, because they don't have time. They have 10 or 15 minutes to see a person, and they have the entire body to worry about. They don't really have the time that it takes to figure out what's going on if somebody's cognition is beginning to decline, because that's a very time and labor intensive process. So the best thing for a primary care person to do is to pick up on or hear from a family member, or sometimes from the person, him or herself, that there's a concern or a worry or an actual problem, and then refer them for the workup. That's why a place like Sunday Health exists. We have the ability to do, a comprehensive diagnostic assessment, which consists of more than a single test. Oftentimes, after a diagnosis has been made, we want to prescribe medication. Medications can help. They stabilize things. They don't really change anything. But that's oftentimes in sort of the standard medical model where treatment ends. And it really is where it should begin.
From this point forward, I'm not aware of anything that can be done. I'm not aware of.
Well, I mean, that's a So neurology used to be known as the specialty of diagnose and adios. Meaning you'd make a diagnosis, didn't have anything to offer that you could tell the patient this is what you have, but we didn't have any way to help them live with having that. Well, now we do. But there have been so many advances in medicine in so many different areas. So a lot of times medications are a huge part of the treatment paradigm for a given condition. There's so many other ways, though, that we can help the dyad, the two people at the center. In your case, your mom and you. And there are ways that just advising you, for example, of things other than cognition that may change and that may make life for your mother more difficult. Depression, anxiety, sleep problems, word-finding difficulties, confusion. Did I mention anxiety? A lot of anxiety goes along with, because when you have something like Alzheimer's disease, the world becomes a different place. And your ability to control what happens to you in it, you can, feel it receding. And that can be terrifying. And then people often can't express that terror. And so then they act out. And they get agitated, or they yell, or they make accusations that aren't true, or they start hiding things, they get restless. We know a lot of things that can happen that are common, but there's no universal playbook for these diseases. So they affect each individual person who has it differently. And a lot of that has to do with who is that person who got the disease, because where they grew up, what kind of schools they went to, how they spent their time, what they ate or drank or didn't. All of those things, are going to be completely different by the time that somebody reaches age 79. No two 79-year-olds are alike, even identical twins. By the time they're 79, they're not so identical anymore. I mean, genetically they're identical, but in so many other ways, nature versus nurture, all that. So as a neurologist specialized in taking care of patients with dementia, I have a sense of the array of services and ways that I can help a family like yours, that a primary care office just doesn't have access to those.
I understand that the brain's a very complicated thing, and what affects one person doesn't affect another. It would be, I guess, great that, to have people in sort of, in a clinical sense, understand that the demeanor and the way in which you come across really, can make all the difference in the world in making, the patient feel more at ease and the caregiver feel more at ease, and make a very stressful situation maybe a little less stressful.
Well, that's why I get out of bed and go to work every day, is to help make a challenging situation into a livable one.
I don't know if I could have really done a fraction of what I have for my mom had I not kept such detailed records. And of course I knew that was always on me to keep. And that was sort of a perfect comment that you made, or phrase that you said, where it was diagnosis and then...
Diagnose and adios.
Diagnose and adios. It really absolutely does feel that way. That there would never be any sort of follow-up. There would never be, it would end right there, obviously, if and it shouldn't be obvious, but it does seem that way, that if I were not the one to advocate for her and to be proactive on her behalf, then she would be completely forgotten. Any little tidbits of information that I can get is very helpful. Beyond that, it would be great to have someone, say, yeah, when this happens, try this or try that. Try asking her about this. Maybe give her this, this supplement, or, drink this, just anything at all that could possibly help in situations like that would be great to know. But yeah, there hasn't been any sort of point person for me to ask, of course, other than Google.
Right, which is the Wild West.
Yeah, and I can't say, what should I give my, mom who has dementia? I can't be that specific with things like that. So yeah, I mean, it would be wonderful to have sort of a repository, an option, anyone that I could go to with questions, because I don't feel like that exists and I'm just sort of winging it.
Right, and winging it must be terrifying.
Yes.
You need a facilitator, and we recognize that, and we acknowledge that, and we will honor that in the future. The world is changing so fast that we're going to be able to help you, your mom, and families like yours more in the future than we have been able to do up until now. That's partly because of new medications. That's partly because we understand the diseases better. That's partly because kids like you, with parents like your mom, are no longer willing to put up with diagnose and adios. And also because there are just every day new advances being made, especially in technology. How much easier do you think it would be for your mother to go to a medical appointment?
Oh my gosh.
If she could do it from the comfort of her kitchen or her couch?
Yeah, I mean, just the process that it takes. I mean, that alone is why she basically was not taken to any appointments, because it takes catching her just right, saying just the right thing at just the right time to get her dressed and out of the house. And I figured it out, luckily, but for anyone else on this planet, she would, kick and scream, and it would not go well.
That's a very common scenario, but it's one of the ways in which the future care model for families like yours, I honestly believe, is going to be better. And I really think Sunday Health and the team that is being put together here is going to be the leading edge of that process. Even just the where am I? I don't know where I am. I have to go home.
Yes.
And oftentimes, gosh, when the person says that, now your mom just moved in with you 14 months ago, you said, but many times the person is standing in the living room of the house they've lived in for 50 years.
Saying I want to go home.
So they are home.
Okay.
And that becomes a shorthand, almost like code. They can't any longer necessarily express in an articulate way what they fear, but they're afraid. And home, what does home represent? Safety, security, love, warmth, family. So when you're terrified, I don't know where I am.
I want to go home.
I want to go home.
Right. I want to feel safe again.
I want to feel safe again. A lot of times the unskilled approach to something like that, somebody's going to try to use logic and reason and say, what are you talking about? Look around you. This is the house you've lived in for 50 years. Don't do that. That's going to, first of all, it's not going to fix the situation, and it may well make it worse. Just give the person a hug.
Yeah. And when she says, how did I get here? I just say, I scooped you up like a babe.
Right.
I say, I scooped you up like a babe, and I just brought you here with me. Is that okay? And she'll say, okay. So.
Well, and you know what? The other thing is go with what works. Don't go with a predetermined sense of what you should be doing.